Greetings in the name of the Lord Jesus Christ, and welcome to today's show. My name is Bosire Benson, and this is all about helping people live meaningful lives in this world. And today we are talking about health matters, and I have a very special guest to help us do that discussion. Welcome, sir, to the program.
Asante.
Can you introduce yourself to our viewers?
Yes, my name is Ronald Nengo Musungu. I am a medical doctor by profession and a medical intern in waiting. And I'm happy to be here.
Yes. You took medicine in school?
Yes, I took. I pursued it, and I'm still pursuing it.
Okay.
I'm in the hot pursuit.
Yeah, you normally joke that we also take medicine, but when we are sick. So welcome again, and it's good to have you in the program, and I know you will be of help to our people, especially concerning matters health. So today we want to talk about pain. Yes. Now tell us, what is pain first and foremost?
So pain is a God-given attribute that we have as human beings, and it's one of those things that we are grateful to God for. But scientifically and biologically speaking, pain is your body's response to unpleasant stimuli, or rather unpleasant interactions that it has with its environment. So, and these can not only be physical, but also emotional unpleasant experiences. So the World Health Organization definition covers both a physical aspect and an emotional one as well.
Hey, spiritual pain.
Spiritual pain is an aspect when you're dealing with pain management, but spiritual pain does inflict on the soul, and soul is where we have our mind and our emotions. So spiritual pain, in as far as it would also reflect on the soul and would fit in the emotional aspect of pain. Yes.
So maybe somebody should do research and we start that direction of research.
Yes.
Okay, so physical pain.
Yes.
So it's my body interacts with the environment, everything that is around me.
Yes.
So one of the ways in which I interact with the environment is through this pain.
Yes, one of the ways, your body
responds to things outside.
Yes.
Okay. So for example, if I knock my foot on a stone, explain to me how that pain is now scientifically.
Oh yes, and
that's for me what I'm feeling is
the pain down there.
Attend to that.
And I mean, a lot of us can relate with that because, and I'm sure most of us have even experienced that. So you are walking down a street or walking on the road, and you stub your foot against a stone or something. So how our body is mapped out is by our nervous system. So I can say every millimeter of your skin, your skin surface has nerve endings that are allocated or assigned to that particular part, so that if you stub your foot, let's say, against a stone, the nerve endings that are mapping out that area, they will be the first ones to respond to that assault by sending signals, kind of like the same way messages are sent. Think about your cell phone.
So, for example, if wiring.
Yes.
There's wiring from my toe.
There's wiring.
To where?
To your spinal cord and then to your brain finally.
So from the toe up until it gets to the spinal cord.
Yes.
Goes up until the brain.
Until the brain.
So the brain is where all the nerves end.
The brain is the central hub for information processing.
So and you said every part of my skin has those nerve endings.
Has those nerve endings.
And those are the ones that respond the first time there's something.
Yes.
Okay.
Yes. So it's fascinating even how you put it, because the nerve endings start as very tiny microscopic little things, but they pull together, sort of like the way a river has tributaries, and form bigger and bigger nerves all the way until they enter your spinal cord till your brain. So now when you stab your foot against a stone, the within a split second, milliseconds, that information is sent faster than any electrical cable, maybe the same speed. It is electricity. It is like electricity, actually.
Okay.
It is an action potential. That's what we call it in the medical world. But it is like electricity that is sent through your nerves, your neurons, and then it goes to your spinal cord, and you're able to act. And also,
so does it reach the brain or the spinal cord first?
So
where's the end?
Both places. Our nervous system is interesting because at the spinal cord level is where you would be able to have the withdrawal response away from the painful. So let's say you've hit yourself against something sharp. Sometimes you'll realize that, or rather most times what you realize is that you draw yourself away from that
sharp
object.
Thinking.
Without even thinking. It's almost automatically. So that comes from your spinal cord. It's sort of like an arc. Think about it as an arc, So you hit your toe. That sensation is sent to your spinal cord. Your spinal cord sends back the message to the muscles of your leg to pull back. Now that reflex arc or withdrawal response happens so fast without even your thinking. But at the same time, the signals are sent up to your brain, to the part of your brain that has been mapped out for that area, and helps your brain actually understand what is going on. It's pain.
So that's when you will look now.
That's when you look.
Look at what has happened.
Yes.
And then try to understand.
Exactly. When you think about it, you'll withdraw, then look. So that happens first, and then you now develop a cognitive awareness later of what's going on.
So at the skin point, where these nerve endings are, if the pressure, normally if I touch, there's nothing. If I touch myself. But if there's pressure more than that, at what point does that become pain?
Yes, now now you see, we now are going into the aspect of what at the molecular level causes pain.
Yes.
Because we have, as you've put it, sometimes you can just be touched. Sometimes there can be pressure applied on your skin, but there is a critical point at which pain begins. Becomes a sensation. So it is just, rather painless until a certain point where pain begins. Now that meeting point or that threshold is defined by what we call pain mediators. So pain mediators are the little bits of molecules that cause that trigger the receptors for pain.
Okay. So what are these? The molecules, like the one that we did in high school, the CHO something.
So they are proteins. For example, proteins, specific kinds of proteins. You have even fatty acids, and
so they are specifically created for that purpose.
Yes, they have. Yes, very likely.
When the pressure exceeds some point, they'll come into
action. They become active, and some of these. Another thing that can help you understand is that some of these things, for example, let me talk about one particular one. It's called arachidonic acid. It is part of the cell membranes of your cells. So when your cells are ruptured because of that pressure. So when there's rupture or breakage of cells, these mediators, due to the rupturing of the membrane, trigger the painful response. And also other than arachidonic acid, there are other mediators that are actually found inside the cell.
The cell itself.
Inside the cell. So that when the cell breaks,
they come
out, and that's what.
Let's send to them. Now the nerve endings pick that one.
Exactly.
Okay. Then the message goes to the brain.
Yes.
Then the brain tells, you look at your foot, you've been hit. Then normally, for example, if you were to take that further, probably you sit down, try to process the pain. Why that? Why do I have to stop? Why shouldn't my mind just continues, just something?
Well, if you're like me and like yourself, pain it jars the mind. It sort of shakes you. You have to attend to it. It has a sense of urgency with it, so that it's in your spinal cord. We have a part of your spinal cord that is responsible for the turning on or off of your awareness. When pain is one of those stimuli that hits that center so strongly that you have to be aware of what's going on. So even if you're sleeping, if the pain is sufficient, it can trigger your brain to wake up because of
attend to the issue.
You
have, before anything else continues, attend to that. But also there is I've realized sometimes when I'm so engrossed in doing something, maybe moving things in the compound, then later in the evening I realized I hurt myself, but I didn't feel at that time.
Yeah.
Can you explain that?
That is interesting, especially now that has to come in the degree of injury. Because if it's a mild injury, if your brain is engrossed on something else, if sometimes the load on the mind can be so significant that certain small injuries actually go unnoticed. You'd look at it this way. For example, if you're walking through a field of grass, or as kids, kids usually like to roll in grass, and when they are rolling in grass, they are so engrossed in the enjoyment of that they don't notice the little blades of grass cutting their bruises. Skin. They're not so big. They're like little cuts by the. Only
microscopic. If you to look at under the microscope, you would see.
It's actually microscopic. Some of them, because you won't see it with your naked eye, but only for them to notice the pain or rather the injury when they are showering at night.
Now you've explained something I've been wondering about.
Yes. So
why is it that when you're coming from the grass, then you're going to shower and you feel
itchy? That's because there were little cuts on your skin, and now when you're bathing when the water, especially when soapy water goes over that injury, it's gonna cause you to want to itch because it's a foreign substance inside, so it's gonna trigger that.
Okay, and I understand now. The pain has come. Like if I can repeat what you said, the spinal cord has sent the response, then the brain is processing that. Now I get to the point where I'm asking myself, what do I do to stop this pain from continuing? What does my brain want me to do when it has brought me the attention to me that this is what it is?
Yes, so your brain wants you, of course, to get away from that. Get away from it.
Whatever is causing it.
Yes, and then given enough time, inflammation is actually a good thing. Because inflammation is your body's way of getting the help, or rather getting what is needed to the site of the resources that are needed to that site of injury. So remember we talked about pain being as a result of injury. So if there is tissue damage, there has to be repair of that tissue.
And it starts immediately.
And it starts near immediately actually. Once the pain has been transmitted to your brain, changes start taking place, like the blood vessels around that area become more porous. They allow more
blood to
fluid, more blood to come there, or more fluid to fill that
the bleeding is also part of that process.
It's part of that process, but of course, that bleeding can happen when there is a breakage in your skin, the skin barrier. But even if there is no breakage, the blood vessels that are there, they leak out more fluid, and that's why sometimes if you've seen a child who has hit their head, it swells up.
So that's because swelling is what you're calling inflammation.
That's part of inflammation. Yeah, that is inflammation. Inflammation consists of the swelling because your blood vessels now want more fluid to get there, and when more fluid gets there, more resources get there for the repair of whatever has been injured.
So that the blood coming brings along the resources
that are needed. Okay. Yes.
So this is what I used to see. I have bumped my head somewhere. Yes. My dad immediately texts me and then he's rubbing. Is that okay?
Well, I think some of those that also they're called anecdotal things that we do, and of course, what they're trying to do is to reduce the swelling. But in no way are they helping the pain. In fact, they make it worse.
Yes.
For most kids, they're being held against their will, screaming out loud. But it does not help.
So you should be allowed to.
Shouldn't be allowed to. Let the swelling happen. Okay. Let the inflammatory process
go on. That's a new thing.
Yeah, let it go on. Because you see, what they're trying to remedy is what they are seeing, which is the swelling. But the swelling,
The issue.
yeah, they're not dealing with what's going on
underlying
under all of that. Yeah,
So just somebody has bumped their head, the knee is coming up. Continue.
Yeah. What you can you can have some ointment, maybe something to soothe the pain, but let the swelling go on. If it's too much, then we'll talk about painkillers.
Okay.
Yeah.
So this inflammation, how long does it have to remain there for it to be considered still okay? Because if the bump is still there 2 weeks later.
2 weeks later, then you might be thinking of something else going on and not
So how
simply.
long can that?
Yeah, it depends on the degree of injury. So if you're thinking of just something like a bump on the head, give it a few days. Once the blood has rushed there, because your body is very active. It's very active even when you're just doing nothing, when you're sleeping, it's very active. So tissue is going to be replaced, tissue is going to be fixed. And then once that has happened, if it's just superficial, let's say it's involving your skin and maybe underlying, did not touch bone, did not touch something harder, then a few days and the smooth or rather what you call it soft tissue will regress. So once the repair has happened, the body knows when to call back those things. Yeah. And even sometimes when you have a break in your skin, let's say you had a cut, then that can take longer. Because now on top of repairing the cells that are broke deeper in the tissues, you also have to repair the cut that is visible, So that is gonna take some time, and that can take even a few weeks sometimes for it to come back together entirely. Yeah.
Then so the bleeding that happens.
Yes.
What should happen if, for example, the cuts?
Yes.
Somebody has cut themselves. What should happen? Should you let the blood flow? Should you try to cover?
If you've cut yourself, number one, stop what you're doing, whatever you're doing. If it's not as important, just drop it. And first thing, get a clean piece of tissue paper or serviette or even cotton wool and apply pressure to that point. The pressure is supposed to counteract. Think about it this way: your blood vessels are like little pipes.
Yes,
that are spraying out blood. So for you to stop the bleeding from that, you have to counter their pressure significantly for them to stop oozing or rather spilling out. So you have to press it in as much as you can. And when you're doing that, you're giving your body a chance to start what is called the clotting process. Clotting process plugs those blood vessels, sort of like stopping them from bleeding anymore. Yeah.
So that is the blood now interacting with the oxygen or something?
Yes. So
then forming the clot on top?
Yes. Now the clotting, that particular kind of clotting which involves exposure to the environment is, as you're saying, the blood actually comes into contact with tissue, what is called like a tissue factor, comes into contact with something that has, when you cut a blood vessel, you have to go through skin.
Yeah,
you have to go through those layers of the skin. So when those layers of the skin are exposed, and even parts of the external part of blood vessels, when they're exposed due to cutting, those form the trigger response for the clotting to happen.
Okay. And that also starts immediately.
That also starts as soon. That might not start immediately. That's why you're holding on to it to keep your blood.
How long should you? Just a minor cut.
If it's a minor cut,
the vegetables and then.
Yeah, I have one. In fact, I held on to this one for about 3 minutes.
3 minutes.
Yeah.
By that time, if you let it.
By that time you let it go, you'll see it as
There's no coming out that much the blood.
No, but so bleeding time, actually, so it's called bleeding time. Give it about up to 5 minutes. Up to 5 minutes for it to stop.
Okay, so now you mentioned that one of the things is the swelling.
Yes.
Then the others.
So yes, the 5 cardinal or the 5 main components of inflammation. So you have your swelling, you have your change of color, or redness, but in Africans sometimes our skin is so dark you may not see the redness, but there's a change in color.
Yeah, that area just
yes, it looked darker sometimes for us. So the swelling, the change in color, the pain, which should be like
that
the first one,
one,
there's local pain, and then you have loss of function.
function.
So loss of function is, for example, if you stub your toe, or if you, if you stub that toe that we were talking about earlier, you might not be able to move that toe anymore. Or rather, if it's your finger, let's say the thumb joint, you lose function of that thumb for some time. It won't function as well as it used to.
I understand.
Yes.
So that's part of inflammation.
That's part of inflammation.
And what is the importance of that losing the function?
As you can almost guess, it's your body. If it can't work anymore because of the injury, that's to help it take a break of movement so that it can recover as well. Yeah.
Because the movement also maybe can aggravate.
It will aggravate the healing process.
So that's number 4, the loss of function. Number 5.
Number 5 is heat. And that usually you feel it.
Touch it. Yeah. Especially, I think one of the ones that is very easy to get. I recently was stung by a wasp.
Oh no!
The heat was there.
It is. And with the wasp sting, it's worse because it injects venom that it has. So that venom actually has properties that break down tissue breaking properties. So it breaks down the cells, and that's why you have a swelling and inflammation goes on there.
The heat and then the throbbing.
The throbbing. Then now throbbing is the blood vessels whose pores have opened up. So the throbbing, it's correlating with the pumping of the blood through your system.
Yeah, so
with every pump,
you feel it.
It pumps, fluid through.
I remember one of the ways we used to describe it, like my heart has gone to the top.
My daughter told me yesterday she can feel her heart in her hand after she had hurt her. Fell on
that's
her,
the same
on
thing.
Her. Yeah, so she's saying, I can feel my heart on my hand.
Amazing. Okay. Now there are other pains that are not external.
Yes.
Headache. What causes them?
Wow, headache. It's a whole topic. So
most of the ones that we feel out here.
So mostly a headache can be as a result of vasodilatation, or rather dilatation of blood vessels in the head.
That's technical. So dilation is
to get bigger, so they can get bigger.
The vessels. Now the
vessels get bigger.
The veins or the arteries or whatever.
Both, either of them. But when the vessels get bigger, they
what
can
would be
cause. So psychological stress can be one of the causes, but also if you have general pain in your body, let's say even if you hit your toe, those same inflammatory mediators, they're produced there, but they circulate through your whole body. So that's why you can have an injury somewhere, or you can be fighting with an infection that is, let's say, in your lungs, but your whole body feels it. It's because as your body is trying to fight the infection through inflammation, the products of inflammation are circulated through your entire body.
Blood goes around.
And goes around and triggers other things that now cause, like the headache. Like we have molecules called interleukins that not only act to cause a raise in body temperature, but can also cause pains like headache and also general body aches. Yes, and that's as a result of the inflammatory process.
So inflammation is one of the things that maybe sometimes somebody is very sick, malaria or something. They say like the whole body is painful.
The whole body is painful, and that's the pain is actually coming from your body fighting. Your body is fighting.
So that's still a good thing that the body, by feeling that one, that the body is doing something.
It is fighting. Exactly. Yes.
And then now let me just summarize that. Yeah. Inflammation is what the body does to try to counter this issue of pain. Okay.
Yeah.
Good.
And injury.
Injury,
yes.
Now, the pain is there, and then we come to you guys and we get painkillers, or we can get for ourselves.
Yes.
First thing, go to the shop, get paracetamol.
Maramoja. Yes.
What do those things do?
So we go back to what we're talking about. What we talked about, the inflammatory mediators or the mediators of pain. So you can think about painkillers, or the other technical term for them is analgesics. You can think about them in 3 main ways. You have your opioid analgesics. You have
it's not opium.
It's referring to that class, that group of drugs. So you have your opioid analgesics. The one that's most familiar or more common with people is morphine. And then which is is a reserve for more severe pain, and things like oxycodone. And then you have your non-opioid analgesics, which are now the ones that you can find even over the counter, OTC. So that's where your paracetamol comes in. That's where you have your diclofenac, which is a member of a bigger group of pain medications called NSAIDs. We won't go into that. But when the doctor, or rather when you go to the shop and you get that Maramoja,
that's paracetamol.
That's, for example, Maramoja, if you look at the back of it, it not only has paracetamol. Some of them, they combine a few drugs. So you can find it has aspirin, it has paracetamol, and might have caffeine at the same time. The good thing with caffeine is that it has a vasoconstrictive effect. The vessels that have dilated,
they can
shrink them back down.
Okay.
That helps with reducing inflammation.
Can I get the same thing from coffee?
Yes.
Oh, okay.
Caffeine can cause vasoconstriction of when it's disseminated systemically through your blood vessels.
Maybe let me ask you, because for example, the people who are so used to tea, I don't want to call them addicts.
Yes.
But if they miss tea, something happens. They have some kind of headache.
Yes, tea does contain caffeine, and you can in significant, let me call it, significant amounts, develop a dependence on caffeine, because caffeine is a stimulant. But a much weaker stimulant than the other stimulants that you've heard of. For example, cocaine is a stimulant, but it's of a much lower degree potency. Okay. So you can, as it's, people like, if you put if people take very very concentrated tea and get used to that, and get used to that effect that it has on your body, then when that's taken away, you can have a dependence on that. Yeah, so
you should be careful.
You should be careful. Don't put tea leaves, but not moderate amount.
Okay.
Yeah, moderate amount.
So then you say the caffeine in it dilates. So for example, the headache.
Yeah, it'll help
constrict
yes.
the dilation that was happening.
Yes.
Then the paracetamol, what does it do exactly?
So paracetamol. Now that, as we were talking about them earlier, they work on the pain mediators. They work to stop the production of these inflammatory, or rather to halt their production, so that you have less and less of a pain, pain message that is being relayed through your neurons. So those work systemically, but the painkillers can also work centrally. That is, they can work in the central nervous system to stop the transmission of pain, the signal of pain through the neurons. So they can actually just stop that transmission of pain.
So the pain is still there. Whatever is causing the pain is there, but it's not being taken to where it needs to be processed.
It is not taken. Yeah. So you can think about this, and especially
so they inhibit or something.
They inhibit. So and it has to come in at the right time. So you hurt yourself first, take away the thing that is continuously causing the pain, and then as the inflammation is going on, you can take your painkillers. Now that you are away from the thing that was causing pain, the painkillers can now come in to help reduce the pain that you're feeling. But now, and that's safe because you are no longer getting hurt. You've taken away
so you don't need the production of that.
So you don't need it anymore.
Okay.
Yes.
Okay. So that normally the medication goes to that point where those molecules are being produced. What do they do to the molecules exactly?
Now that's interesting, and I'll have to review that information. And it depends. So you have a molecule like paracetamol. It's coming to me. So they actually work on the pain mediators. So So paracetamol, one of the pain mediators comes from a root molecule called arachidonic acid. So arachidonic acid is broken down to form the painful mediators. So paracetamol is going to come in and halt the enzymes that are involved in the process in breaking down arachidonic acid to the painful mediators. So one of those enzymes is one called cyclooxygenase. So in short, COX. So there's a COX-1 and a COX-2. So when the medication comes in and goes to that site, it blocks these enzymes. So it blocks the production of the pain mediators, and in so doing stops the pain. Yeah.
And then that has to happen. Normally, I see they say after 3 hours you have to take again.
Yes.
Because
now you see
flushed out of the system.
Yes, it is flushed out of the system. Yes. Yeah. The medication, once you take it in, it goes there, but that place, wherever the pain is going on, that place is still active. So blood is being pumped into that place and it's being taken out. So as they're taking out blood, they're taking out the drug. So eventually, the drug levels at the site will drop below the effective.
Pain will come back again.
Yeah. Then you have to. Yeah, the pain will come back again. Then you have to get drugs.
You mentioned earlier about applying if you have a bump.
Yeah.
You call it ointment or something?
Ointment, yes.
Yeah. What does it do also to that point?
So, well, you have it's the same. It's basically the same thing. It's the same drugs, but now the absorption is what is different. So the ones that you take orally are absorbed in your stomach and in your small intestines into the blood, but the ones that you apply topical are designed in such a way that they seep in through the skin to the place that is causing pain. A good example of this is that you can have diclofenac gel that can be applied topically, and you can have that can be taken orally.
Oh yeah, I've seen that one, the gel.
The diclofenac gel, yes, yeah. Diclogel. And it's
so there's medication also called the same name, but now you just take it.
Yes. So and you see they have to be made differently. For example, someone who has wrist pain, taking the medication orally, in as far as it will be effective, it might take a longer time to get there because when you take it orally, it has to go to the stomach, be absorbed. Now, from the absorption in the stomach, before it gets to where it needs to go, it has to go through the liver, and then from the liver, it can go to the heart, where it's now pumped to the rest of your system.
And then it doesn't just come here; it will go everywhere.
It will go everywhere. But if you apply it topically,
it will be here.
It will be here, and the duration to relief is reduced significantly. Yeah.
Then the one that sometimes the same painkillers are done through the veins.
Through the veins, yes. Now it depends what let's say for example, there are painkillers that can be administered to the veins. You can administer paracetamol, for example, through the veins.
So it can also be liquid.
Yes, it can be. So, but that is usually a reserve of the hospital setting, mostly, where we can have a venous access. Yeah, and actually for some even for some children, you can administer pain medications rectally. If you've had little babies, little children, when they go to the hospital, sometimes they push in a suppository, or you can call it a drug through the anal opening to the rectum. Well, now why we do this for children especially, one of the reasons at least, is because either they have been vomiting, so the kids have been vomiting too much, so that will definitely be spilled out. And then the rectum has the advantage of having being able to absorb the drug directly to the liver.
Oh, yeah.
And bypassing the whole intestine process. So there are blood vessels there that bypass that whole other system and take the blood directly to the liver, so that from the liver it goes to the heart for it to be pumped across. Yeah.
So the process becomes shorter.
And more effective. Yeah.
Good to understand those things. Yeah. Now, most people, I think, the most painkillers they take are for headaches.
Yes.
Why so? Why is that the most common pain that people need to address?
Headaches, as we have talked about earlier, we have things like tension headaches. We have different types of headaches. We have one called a tension headache that feels like a band on your head.
Yeah.
Sometimes you can feel like a band is tightening on your head. You have another kind of headache called migraines. That usually is felt more around this area, and it's coupled with a sensitivity to light. And then you have global headaches that involve like the entire, you feel like it's the whole head that aching. And you have other types as well. You have a cluster headache, which comes and goes, has a sort of like an intermittent but random distribution in terms of how it presents itself. So headache is, I don't know why it's the most common one, but it's caused by a multiplicity of things. So, and most of these things you can encounter in life. For example, if noise is too loud, if you went through a noisy day, you're likely going to have a headache. If you travel for too long, you're likely going to have a headache.
Enough water.
If you didn't drink enough water, now you're going to have a headache.
So before then, if we're able to know why the headache is there,
yes,
should it be that we address that underlying issue before the medication?
Yeah, and yes, exactly.
So, for example, if I've traveled
the
whole day, should I look for paracetamol or what?
Yeah, I mean, and I like how you're talking about it, because that's a proactive approach to pain and to head. For example, what you're talking about, headache. So you need to look at it and assess what is that thing that causes me the pain. How can I remedy it aside from using medications? Like, for example, you're traveling. If you're traveling to Nairobi, the proactivity would say, have enough water. Hydrate well throughout. The other thing is, if you're like me and the warm confines of a moving vehicle give you body pains, you can position yourself somewhere like next to a window where the fresh air will help you out. And for what else? If you work in a noisy environment, then you can consider having protective
headphones,
headphones, and some headphones actually nowadays, or the earpods, they come in with noise cancellation, so that when you put them on, they help.
Don't hear the surrounding environment.
Exactly. And for example, other people who have headaches because of light, who sit in front of a TV, or rather not even a TV, but a monitor every day, working on. You can have blue light filters or something that helps filter, glasses that help filter some of those harmful rays from blue rays. Now, they're not harmful in a short span, but for a long time, they're going to give you a headache. Yeah. And also taking breaks from work.
Yeah.
Take a walk, take a break from looking at the screen, and that will help also ease the stress.
Okay.
Actually, headaches can be thought about like this way, that it is one of the primary ways your body responds to stress. So however the stress
comes, it's telling you what that pain is telling you.
Yes.
There's something you need to address.
Yeah, there's stress in your body. There's stress.
You need to find a way to stop that. Like the pain that you're talking about for the toe.
Yeah.
The first thing is to get away from the source of that pain.
Yes.
So the same could be the reason why you have an headache, and then basically your body is telling you there's something that is causing this pressure, stress.
Yeah.
Can you withdraw?
Can you do something about it? Yeah. Withdraw a bit.
Not to go and take medication and then come right on.
Help me out, yeah. But sometimes medication helps because of the acute nature of the pain. Because if the pain is here now, you forgot to drink your water. Then you have two options. You either tough it out through the pain and get some rest, or take medications that will help quicken that process.
You have still to address the issue.
But you have to address the issue.
You have to still drink water if that is the issue.
If that's the issue, you have to ensure that you're well hydrated. Okay.
Yeah. Now, two more pains and then we finish.
Yes.
One of for the children, stomach issues.
Yes.
Pain. How does the pain in the stomach differ from these other pains?
Yes, and this is a wonderful question, because it's one of the things even doctors usually ask when it comes to characterizing pain. So pain has different phases. And not only for children, even for adults. So you have pain that is sharp, like like being pricked by something. And then you have dull pain, like what you'd feel in your stomach. Like if you have a tummy ache, you almost feel like the pain is in a big area, not as precise.
Point,
not as precise as a sharp pain. And then you have other descriptions of pain, like shooting pain, or for example, and this happens to old patients. So what happens is that atakuja aseme, daktari, nasikia uchungu inatoka hapa, nasikia imekimbia hapa kwa huku. What she's describing is shooting pain. So that pain is like lightning, kama stima. Nasema nasikia kama imepita hivi. So that doctors were trained to listen to that and interpret that correctly. And then you have another one that's tingling. The same way, the same pain you'd feel when you sit on a part of your body for too long. It's almost as if it has pins and needles. That's a tingling sensation. That points to something else, some other cause for pain. And a few others. Maybe I'm forgetting a few. And you have others that are throbbing. Like it's a throbbing pain. And for example, now what we're talking about, the stomach. Now, the organs inside the organs that you have inside your body, they are not as well mapped as your skin.
You mean mapped is?
You remember what we were talking about? The nerves.
Endings, okay.
Yeah, the nerve endings, how they are well mapped in your skin.
So on the liver.
So in your inner, like your liver.
There are not that many.
There are not that many. So like if you're looking at it per centimeter or per cubic centimeter, the innervation in there is not as accurate, is not as much. So one of the things that's a result of that is that when you have pain inside, it's not as specific. So a child can be complaining. It's a region. A child could be having stomach problems and will complain of pain in the abdominal area. The same child could be having, intestinal cramps due to maybe they ate something bad and it has moved down to the intestines. And they will still complain of pain around the abdominal region. And for those who are older, who have had appendicitis, like an inflamed appendix, they would also, at the early stages of their pain, complain of a general abdominal pain.
Actually, the problem is the appendix.
Yes.
Still, they feel like it's everywhere.
It's a general area in the abdomen. Of course, they won't feel it in the chest, but they'll feel it generally in the abdomen. And when you think about those organs, they're like, they're separated by a good amount of space, because your stomach is up here. Your intestines are more or less in the middle of your abdomen, and then the appendix for most people tends to be on the lower right side. But when their pain is, when you feel pain in those areas, they tend to be general. So to answer as you're answering your question, so that's what stomach pain. That's why it's like that. That's why it's characterized that way.
So even for people who have ulcers, for example,
yes,
they don't feel specific pain somewhere. It is a region they feel.
Yes.
Okay.
They feel a region, but also with ulcer pain, because it has other aspects that make it very easily recognizable. Because with ulcer pain, it's a wound on your stomach lining.
So it's the stomach, inside the stomach.
It's inside, mostly either the stomach or a part of your intestine just after the stomach, called the duodenum. So you have an ulcer. So that wound is going to contribute to a certain characteristic of that pain, that it may feel like a burning sensation. And of course, the burning is because you have acid that's being produced in your stomach. So that may contribute to the specificity of ulcer pain, as opposed to, for example, a stomach ache. When you have a stomach ache, it is muscle cramps. Like the same way you used to have muscle cramps in your legs.
So it's the muscles contracting.
Yes, they're in spasm, or they have tied themselves into knots because of one reason or the other. And most of the time, if it is something you've eaten, your body, it's actually it wants to
remove whatever it is. So that's the reason for the spasms. The
Yes.
movement, that contraction. Okay.
Yes, most of the time.
That's what will become the pain.
Now that characteristic movement, is what will cause that pain. And cramping, if it's coming from that movement of the stomach and the intestines, will have sort of like an up and down, an up and down
Comes and
course. Yeah, so you feel it comes and just comes.
And after the food is removed, whatever was causing it is removed, then the pain should subside.
It will subside slowly, because it's over time it will subside. Yes.
Okay.
Yeah.
So
that's
when
good
children when children complain of the stomach, we shouldn't. If it's something bad they ate, it will be one of the reasons, but it shouldn't be automatically that we assume is a particular part of the body that is having the issue.
Yes.
Should have someone look at the issue. It could be something else.
It could be something else, and doctors were trained to one of the most important things that helps a doctor determine what could be going wrong is patient history. So just being able to listening skills, and asking the right questions, so that you're able to elicit
information.
What is the right information.
Okay.
Yeah.
Okay. Good.
Yeah.
Now the last pain we can deal with today is the back pain, which is also a very common issue out here.
Yes.
What is the main cause? You alluded to something like the back for the older patients. You were saying that there could be pain, there could be pressure applied on
the nerves.
The nerves.
Yes.
Is that the only reason, Ama?
That's the more, depending on the demographic. So for the older people, that could be what's going on. We call it radiculopathy, where the nerve is being compressed. And our bodies are not permanent; they're temporal. Yeah.
So what do you mean?
The wear and tear happens. See, as by the time you're getting, let's say, to 60 or 50, you've been through considerable stress, and depending also on your occupation, as we're talking about these older people, we tend to see in orthopedic clinics, especially, we tend to see a lot of patients who are coming in who have back pain. And when you ask them, okay, what do you do? What do you, they'll most likely give you an occupation that has them standing up most of the time. So we've seen teachers coming in. We've seen let's say people who are involved in manual labor coming in, policemen who find themselves standing all the time. So that consistent strain on the back muscles leads to that painful spasms of the back muscles. Now, I have to be clear here. The pain, as we are talking about, the back pain, can come from the compression of nerves, but can also come from muscle spasms. The same kind of spasms we were talking about here. The same spasm can happen on your back. Just a different type of muscle. The muscle that is inside your visceral organs or your internal organs, the smooth muscles. The ones here, we call them skeletal muscles. But when they go into spasm,
strings.
Yes, the ones that look like strings. When they go into spasm, you'll feel
that pain should be more.
That pain will be there. It will
compared to the one for the smooth muscles.
It may not be more. It will just be better located.
Oh, you can
pinpoint it, better mapped. Yeah. So there is spasms, there is nerve compression. Another common, but that basically covers it. Because now the causes is what splits. For a younger person, let's say back pain would be because of posture. Like personally, I had either sitting badly the whole day. So when you're sitting, an important thing to look out for is lumbar support.
Lumbar is what?
The lower back support.
So the lower back should be
well supported. We should be well supported. Okay. You should have a chair that is. When you look at these, these chairs that are designed for people who sit for long periods of time, you notice that the lower back has been arched out like this. Okay. It's supposed to help your back support. Yeah, it's because if you look at a person's back, there are muscles that run through that help keep the person's body erect. Let's say if you're standing up, if those muscles weren't there, you'd fall over. but those muscles are
keep
in
you-
constant, yes, so they're in constant contraction to hold you up. So if they're holding you up like this for a long period of time, and remember these are skeletal muscles, they tire. If they're holding you up like this for a long period of time, by the time you're giving them a rest, they'll be worn out, or rather they'll be very tired.
Yeah.
And sometimes they go into spasms.
Well, now that's the spasm you're talking about. Now, as a reaction of being stressed for too long.
The same way those guys who played sports, if you overstretch your muscle, you can get a muscle pull.
Well,
The muscle goes into spasm. Yeah, so it clogs up like this. When it does that, you have pain. Back there.
Okay.
So other than that back support, you need to also regulate how the length of activity you do. So give your muscles time to relax. Give them time to relax.
Okay. And that's especially for the young people, because sometimes because you're young, we think I don't feel the pain yet.
Yeah.
But it can come back later.
It will. Yeah.
You're not changing the muscles.
There are those ones. Yeah. It's interesting. Human beings don't have. We're not like cars.
The
Spare parts. We don't have spare parts.
Okay.
Yeah.
Okay, that's important to know, so that people know that this has to be a lifestyle issue. We should start all these things when we're still young. How do exercises help in body processing the pain? Do people who exercise do better in handling pain?
That's a good question. Now, pain threshold or the degree of pain that is tolerable by an individual is shaped by experience, such that a woman, for example, who is used to feeling menstrual cramps every other month, her pain threshold tends to be higher. So that for pain to elicit discomfort in her, it has to meet that
Beyond
threshold. Whereas for most men who don't have monthly pains, and we've seen this in the hospital, it's interesting. Some men tend to have a more sharper sensitization to pain, so that they feel pain more acutely, or rather they're more sensitive. But it's that threshold thing, yeah. So that's pain threshold. That is shaped by experience. Now, exercise may not cause much difference when it comes to how someone feels pain. But if you do painful exercise, maybe that can raise your threshold for pain. But also painful exercise, you need to be careful, because pain is one of, as we had said, pain is one of the ways your body tells you if you're going beyond too far. So doing exercise that causes significant pain, too much pain, is you're hurting your body. So you need to have a limit for that. Now, pain is good even when you're exercising, but it has to have a limit. It has to have a limit. There's a good burn. People who are used to running or exercising, there's a burning sensation that sometimes they get. There's a time when that burning sensation is good. It means your muscles are under stress, the right kind of stress
to
help them grow, and hypertrophy or grow bigger. But when that's too much, then you're damaging them beyond what repair can fix, at least within a short time.
Okay.
Yeah.
Good. Remember, there's a story I had. I think it's Rabbi Zacharias was saying, a girl who was born without the ability to feel pain, and probably don't know the issue. And the mother, that's the punchline of the story. The mother was praying every day that the daughter would feel pain.
Yeah. And I would imagine why, because imagine if your child has no concept of pain and they're growing up in a world where they're exploring everything. So this child will put her hand or his hand in a fire, and because they feel no pain,
but the damage is happening.
The damage is happening. The tissue is being...
Is that the same thing like leprosy?
Yeah, leprosy. At least what we see it in the Bible, it messes with your nerves. It would attack the nerves, so that the nerves are eaten away. And when nerves are eaten away, initially it is very painful, but as you eat your nerves away, then that place lacks sensation. And when sensation is gone, then that thing can actually just fall off because of injury. The same way it happens in diabetes, come to think of it, where you have distraction of nerves, especially the peripheral
diabetes
nerves.
affects the nerves.
Affects the nerves. It's one of the complications of diabetes is what we call peripheral neuropathy, and that is damage of blood of the nerves. And when that happens, people, the individual lose the sense of sensation. So you get them. For example, they can have a stone in their foot, in their shoe, and that stone, presses on the skin. But because they don't feel it, that stone breaks through and hurts their skin.
Wow, that's
so pain is good. Pain is good.
It's a good thing. It's a God-given gift.
It's a God-given.
Which is one of the things that sometimes we don't find easy to understand.
Yes.
It is of God that it's a system to warn us that something is bad and needs to be attended to.
Yeah.
Okay, and then I think talking about all this pain thing, recently we had the Easter, the kind of pain Jesus felt on the cross. Imagine those nails. And I was thinking the other day that when he told Thomas, just put your finger here. It looks like he was not completely healed.
Yes. It looks like there's still a wound.
He's touching the wound.
So he felt it and he was like, this is where the spear went through. You never know, maybe Jesus winced. He was like, hey.
He had a glorified body. I don't know how that processes pain as well.
Yeah, exactly.
Yeah, but also this is a concept that needs to run with us in the sense that God is the one who gives the pain. We can abuse, like we've abused many other things.
Yes.
We need to learn how best to address. When our body feels pain, we need to find, before rushing to the medication, just something you can do to address the underlying issue.
Yes. So that medication becomes something that you use either that one time and it doesn't move into something that is used regularly.
Yeah.
Yes.
We don't become dependent. And like you're mentioning, proactive. If I know if I'm traveling, I need to do something. If I'm stressed, I need to address the stress, not the medication directly first. I can stop some things from happening.
Yes.
I can understand my body better. Yes. I think that's also the whole concept of being good stewards of our bodies.
Yes.
So understanding and then knowing what to do.
Yeah. And taking rest.
Yeah,
like God did.
Yeah.
Important. You're just having a day when you
do nothing,
are away from work.
That helps the body also recover.
Yes.
Okay.
Yeah, our body works in cycles, the same way even how God created things. There are times when things have to rest so that you can work and then rest and work. You rest better when you work hard. That's a fact.
Wow. Yeah. You rest better
when you work hard. When you've worked hard. The sleep, the sleep that comes when you've worked hard, you don't feel it coming over you. It knocks you out and you wake up fresh.
The body has recovered.
Yes.
It just needs to give us time to do these things out. Exactly. Any final thoughts as we wind up?
Maybe that would be the final thought, that we need to take care of our bodies. We are stewards of these bodies, and in as much as we need to work hard with what God has given us, we need to remember that God instituted a day of rest, instituted ways to help us cope with life here.
Even sleep is
and even sleep. Sleep is important. So my closing remarks would be that even as we work hard, even as we apply ourselves in our day-to-day, let us not treat our bodies as, as what do you call it, beasts of burden or machines, so that you're driving your body at its edge every other day. Work well, work hard, work effectively, so that as you are alternating between sleep and rest, you're able to not only make maximum use of your time, but also you're able to take care of your body as God intended.
And productivity is higher when you give the body what it requires.
Exactly.
You'll be more productive.
You'll be more productive.
Just counterintuitive. People think, no, I need to push my body.
Yeah.
Okay, yeah. Thank you so much for that. I think there is a lot we've learned.
Yes.
And we will be having you soon again.
Asante.
Okay. Yes. For now, thank you so much for being with us also. Goodbye and see you next time. God bless you.
Thank you.